thrombosis. Formation of the clot inside the blood vessels is called as thrombosis. Van Willebrand's disease, deficiency of Van Willebrand factor, causes bleeding disorder called as Van Willebrand's disease. This protein is responsible for platelet adherence to endothelium of blood vessels during hemostasis. Van Willebrand factor complexes with factor 8, and in circulation the complex as a whole circulates. Thus it is responsible for survival and maintenance of factor 8 in plasma. In von Willebrand's disease, platelet adhesion is reduced and thus hemostasis is affected. So this is how the platelets gets adhered to the subendothelial collagen with the help of von Willebrand factor and also with the help of glycoprotein 1b. Hemophilia. It's a bleeding disorder due to deficiency of some clotting factors that occurs exclusively in males. It is an inherited sex-linked anomaly due to abnormal gene on X chromosome. Here clotting time is prolonged, but bleeding time is normal. Treatment could be the fresh blood transfusion. The factor it is because factor 8 is lost on storage. Then by giving injection of factor 8 and factor 9, or by injecting thrombin or thromboplastin. The hemophilia can be of two types, hemophilia A or hemophilia B. Hemophilia A is also called as classical hemophilia, where factor 8 is absent and it is relatively common. Whereas hemophilia B is also called as Christmas disease, where factor 9 is deficient. So this diagram shows the inheritance of the hemophilia, where here the females are carrier and the 50% of the females born are they are normal and 50% are the carriers, and 50% of the male they are born are normal, whereas 50% they are affected because of the X-linked recessive disorder. Purpura. It's a condition characterized by spontaneous hemorrhages beneath the skin, mucous membrane, and in the internal organs. Bleeding time is prolonged. The normal is between 2 to 5 minutes, and clotting time is normal. This may be due to decreased platelet count, that is thrombocytopenic purpura. It can be drug induced like quinine, ergots, and iodine. It can be because of defective capillary contractility as well. The different forms of purpura are thrombocytopenic purpura, where there is a reduced platelet count, thrombocytopenic purpura, that is normal platelet count, and thrombocytopenic purpura, whereas abnormal circulating platelet but the count is normal. Here the physical the shape of the platelet is abnormal. Treatment by injecting corticosteroids or ACTH, or it can be done by splenectomy. This is a diagram showing the petecase in thrombocytopenic or thrombocytopenic purpura, where you can see small raised areas of bleeding underneath the skin.